94-year-old Val Fell still lives at home alone with a little outside help.
Tea or coffee?
She spends much of her time educating other elderly people about the need to keep their COVID vaccinations up to date.
I think we actually have more COVID now than we did in the middle of the pandemic. And there is a degree of complacency.
But the warnings aren't getting through to all.
I've had COVID twice now, so I thought, well, if I'm going to get it, I'm going to get it.
People have got a bit tired of hearing about it and maybe they're not being very sensible.
With almost 200 deaths nationwide last week alone, the stakes are high.
I think we've all become a bit COVID fatigued, and so I think the idea of having another booster, but we know it does work, and particularly for aged care homes, which are high-risk locations.
Nationally, just over half of aged care residents have received a booster shot in the past 6 months. On a state-by-state breakdown, the ACT has the highest rate at almost 63%. Tasmania, Victoria and South Australia are sitting above the national average, while in Queensland and Western Australia, less than half of residents have had a booster. The Northern Territory has the lowest rate of all, with fewer than 40% of residents up to date.
We're not far past that peak, so we're still at a point where we're seeing quite a few infections in the community and the risk is still high. And of course, we're still in winter, which does pose a threat.
Despite the low vaccination rates in aged care homes, advocacy groups say some facilities have begun introducing harsh lockdowns again and keeping out visitors. They say residents have the right to see one close friend or family member, even during lockdowns. Val Fell has had 5 jabs so far.
I know some people who've only had 2, and I sort of really feel that they are putting themselves and other people at risk.
Doing her bit to keep the community safe. Jean Kennedy, ABC News.